Do you know the difference between steroids or medicines? The reason I'm covering it in this video is because most people actually don't know the difference, and it's preventing most people from getting life-changing or life-saving medications that they need because their misconceptions are preventing them from seeing the doctor and getting the right treatment. And the reason I'm talking about this in educational fashion is because in the UK, all of these things are legal to possess and use. So it's completely a moral decision whether you use them or not. It's your body, you can decide what the hell you do with it. So it should be your decision to make, but most people are not making informed decisions because no one is actually explaining how to do things properly. It's either encouragement of use, which I don't agree with, or discouragement of use because of misconceptions, which I also don't agree with. I sit in the middle and say, I want to give you the information, you're an adult, you can make your own decisions. And it is legal to do so. We have fast and slow-acting insulin, growth hormone, liraglutide, which is an appetite suppressant, propranolol, which is a beta blocker to slow your heart rate down, thyroid medication, 2 types of testosterone and testosterone gel, clenbuterol, winstrol, anavar, proviron, trenbolone, which is on its own. The reason trenbolone is on its own because it's never had a place in a medical setting. It is purely performance enhancement. It was used in cattle in the past. That is it, and it is the most toxic thing on this table, which is why it lives over there. The rest of them have all, as far as I know, had a place or do still have a place in a medical setting. Then we have anadrol that are used to bring up people's blood cell count when they have anemia. But then they've been replaced by EPO, and EPO is what long distance athletes would use to bring their blood cell count up. This is what someone like Lance Armstrong got his medals taken away for using. But they would also have a similar effect. But they're also performance enhancement because they would also help you gain muscle and increase performance. Proviron is definitely used with testosterone in HRT. Anavar was used in burns victims. Clenbuterol was used in the past for people with breathing difficulties because it often opens up the lungs, but it's also used as a fat burner, so it is mostly performance enhancement. The rest of these can be picked up in many pharmacies worldwide, and especially with things like insulin, it's life-saving, growth hormone, life-changing, liraglutide, appetite suppressant, life-changing. This is what I would say is life-saving because without propranolol, which is prescribed to me, I would have had a serious heart condition right now. So for me, that's life-saving. This is life-changing. Thyroid medication. I don't convert T4 to T3 properly. So without T3, my thyroid level tanks. So I actually need that as a medical reason. Proviron I rarely use, but it's often used to enhance the effects of things like testosterone in a hormone replacement setting. But then this is where I want to get to as the most important, because I'm going to cover all these in other videos. Things like estrogen and testosterone. Testosterone, gel would use for women. Injections we would often use for men. There is also an injectable form for women, which is a lower dosage. So hopefully this video has been really helpful as a start off to what will be a lot more detail into all of these things in an educational fashion to help people and be empowered with information and make informed decisions. That is what I'm trying to do here. Empower people to make the right decision. Not encouraging or discouraging in any way. Hopefully this video has been helpful. Please do like and comment on what you'd like to see more of. And if you want any assistance in any of this stuff and any advice, please do drop me a message. I know there's not a lot of advice out there and a lot of people are really, really struggling, especially when it comes to things like hormone replacement. I'm here to help, so please do drop me a message if you need anything. Take care, guys. I'll see you all soon.